I need to share a hard truth that has been eating at me for years, and the moment I say it out loud, I know some of my medical colleagues will be very upset. After 2 decades practicing medicine, watching what happens to patients who follow every health recommendation, I cannot keep quiet anymore. Here is the reality nobody wants to admit. Sometimes the absolute worst thing you can do for your health is to get too many medical tests. This is true after you reach 60. Now, I can hear you thinking, is not a doctor supposed to tell me to get checked for absolutely everything? Is not prevention the entire point of modern medicine? We are taught to catch things early, but that common message completely leaves out the most critical part of the story. It ignores what actually happens after you find something. Those popular advertisements for health screenings never mention the aftermath. They do not tell you that once you find something, even a tiny abnormality that would never actually hurt you, the medical wheels start turning. Often, those wheels end up running right over your quality of life. I want to be perfectly clear that I am not saying this to scare you away from traditional medical care. My goal is to ensure you fully understand what you are signing up for before you automatically say yes to every single screening offered. To understand this, you need to learn about a concept that changed the way I practice medicine. It is called the cascade effect. Once you see the cascade effect in action, you can never unsee it. Here is exactly how this dangerous cycle works. You go into a clinic for a routine screening test. At this moment, you feel perfectly fine, living your life without a single symptom. Then, the test results come back and show something slightly unusual. Maybe it is a tiny spot, a faint shadow, or a blood number that is just a little bit off. That unusual thing might be completely harmless. It might have been safely sitting inside your body for 20 years and would happily sit there for 20 more without ever causing pain. But here is the major problem. Your doctor sees that result, and now they feel obligated to do something about it. They ask themselves, what if we ignore it and it turns out to be serious? So, your doctor sends you to a specialist. That specialist wants to be thorough, so they order another detailed test. When that second test shows the exact same unclear shadow, the conversation suddenly turns to a biopsy or an invasive surgical procedure. Every single one of those extra medical steps carries severe risks like serious infections, heavy bleeding, and massive psychological anxiety. Here is the ultimate tragedy of this situation. When you finally get to the end of that terrifying journey, 9 times out of 10, you find out it was absolutely nothing. It was never going to hurt you. However, you have now been through months of extreme worry, endured invasive procedures, and might have even suffered physical complications. You end up worse off than when you started, all because of one test you received when you felt healthy. That is the cascade effect. That cascade effect starts with a single test that maybe you never needed in the first place. So, let us talk about the first specific test that I see causing this exact problem over and over again. This one is incredibly tricky because it sounds so smart, so modern, and so wonderfully preventive. I am talking about whole body scans, full body MRIs, or CT scans that promise to check absolutely everything at once. You have probably seen the advertisements for these clinics. They promise to scan you from head to toe and catch anything before it becomes a problem. It sounds amazing, does it not? The idea of getting a complete picture of what is going on inside you and having total control over your destiny is incredibly appealing. I truly understand why people pay for this, but as an educator and a medical professional, I need you to see what happens in reality. Let us say you are 65 years old. You feel great, you are active, and you have 0 symptoms of illness. You decide to get one of these scans just to be perfectly safe. You go in, lie down in the machine for 30 minutes, and a couple of days later you receive your results. Right there in the report, the radiologist mentions something. It is a small nodule in your lung, maybe 3 millimeters, about the size of a pencil eraser. Or perhaps it is a tiny cyst in your kidney or a small spot on your liver. The official report says they recommend follow-up imaging in 3 to 6 months. How do you feel in that exact moment? You walked into that clinic feeling strong and healthy, but you came out being told there is a mysterious shadow in your body that needs watching. You probably cannot think about anything else. Every time you take a deep breath, you wonder about that lung nodule. 3 months later, you go back for another scan. The radiologist recommends seeing a specialist, and that specialist wants to be thorough, so they recommend a biopsy. A biopsy is not a simple thing. It means putting you under anesthesia, sticking a needle deep into your organ, and exposing you to the risks of serious infection and heavy bleeding. Here is the most important medical education I can offer you today. When researchers scan healthy people over 60, they find something unusual in almost everybody. We are talking about 90 to 95% of people having little spots, cysts, or shadows. The medical term for these is incidental findings. The vast majority of them will never cause a single problem. They are simply part of having a body that has been alive for 6 or 7 decades. They are exactly like wrinkles on the inside, but once we find them, we cannot ignore them, and that is when the dangerous cascade begins. Research clearly shows that people who got these whole-body scans did not live any longer than people who skipped them. They did not avoid diseases. They just suffered significantly higher rates of anxiety, depression, and unnecessary invasive procedures. The scans did not make them healthier, they made them feel sicker. I am not saying you should ignore your health. I am saying you must pay attention to the right things. Instead of taking a picture of your insides, evaluate how your body actually functions. Can you walk up 2 flights of stairs without getting winded? Can you get up from a chair without using your hands? How is your daily balance and your nightly sleep? These functional measures tell us far more about your true health and longevity than any expensive machine ever could. I am curious about your experiences with this topic. Have you or someone you love ever been pressured into getting a full body scan or a similar test only to find something that caused massive anxiety but turned out to be completely harmless? Please let me know in the comments below, because sharing these stories helps everyone learn. This focus on daily function leads right into the second test. It affects so many people because it touches on the deepest fear we all share as we get older. I am talking about getting a brain MRI for minor memory issues. Here is the exact scenario I see almost every single week in my clinical practice. You are in your mid-70s, and you notice that sometimes you cannot remember the name of that actor you like, or you walk into a room and completely forget why you went in there. This is normal and happens to everybody as they age, but maybe your adult children are worried. They hear about cognitive decline and push you to get a brain scan just to be sure. I understand that fear. Nobody wants to think about losing themselves to Alzheimer's disease. But here is what I need you to understand from an educational perspective. Getting a brain MRI for mild forgetfulness is almost never helpful, and it is frequently harmful. Let me tell you what happens. You get the MRI, and a few days later you are sitting in a clinic reading the radiology report. The report uses terrifying words. It will say things like mild cerebral atrophy, age-related changes, white matter lesions, and small vessel disease. It sounds like your brain is deteriorating, and suddenly you are walking around with massive anxiety thinking you have a severe disease. Here is the medical truth that you need to know. Those findings are completely normal for someone in their 70s. They are simply describing what almost every human brain looks like at that specific age. Think about it this way. It is exactly like taking a photograph of your skin at 75 and being shocked by wrinkles and age spots. Of course it does. That is just what skin looks like after decades of living. The massive problem is that these complex medical terms do not sound normal to you. Studies show that when we scan the brains of healthy people over 75, more than 90% of them have findings that look abnormal on the official report. Yet, most of those people have perfectly normal memory and thinking skills. The images simply do not match reality. I have treated people reading complex books and managing finances whose MRI looks terrible. I have also seen people with early dementia whose MRI looks completely normal, which proves the picture does not tell the whole story. So what should you do instead if you are genuinely worried about your memory or your cognitive health? There is a much better, safer way to check. We can do simple tests right in the office that take 10 minutes. We ask you to remember 3 words: draw a clock or count backwards. This actually measures how your brain is functioning, not just how it looks on a screen. If those functional tests show a real struggle, then we start looking for causes. You might be surprised to learn that most causes of memory problems in older adults are actually reversible. It could be a medication making you foggy, low vitamin B12, underlying depression, or a thyroid problem. Fixing one of those things often brings the memory right back to normal, completely skipping the anxiety of an MRI. If someone gets progressively worse, gets lost in familiar places, or cannot manage their finances, that requires a full medical workup. But for everyday forgetfulness, chasing a picture creates far more panic than peace of mind, and it rarely improves your overall quality of life. Now that we clearly understand how easily we can misinterpret normal brain aging, let us move right into the third medical test on my list. This specific test surprises a lot of people because it seems so logical at first. I am talking about routine stress tests for your heart, specifically the practice of putting someone on a treadmill just because they have reached a certain age. Here is the typical medical situation I see happening all the time. Imagine you are 72 years old and going into the clinic for routine surgery. It is nothing major, perhaps just a simple hernia repair or a knee replacement. However, the strict hospital protocol dictates that everyone over 70 needs a cardiac stress test before any surgical procedure. So even though you feel absolutely fine and can easily walk a couple of miles without any chest pain or shortness of breath, they put you on a treadmill. I want you to think about this logically from an educational perspective. If you can walk 2 miles in your normal daily life without a single problem, what exactly is the artificial treadmill test going to tell us that we do not already know? Your daily life is your ultimate stress test, and you are already passing it every single day. But protocol is protocol, so you get on that treadmill anyway. Here is where the situation gets deeply problematic and where the dangerous cascade effect takes over once again. Stress tests have a remarkably high rate of false positive results in older adults. That means the test strongly suggests something is wrong when your heart is perfectly fine. This false alarm could happen because your maximum heart rate does not go up like it used to, or because of everyday medications you are taking. But once that test comes back as abnormal, you are officially stuck on the unstoppable medical conveyor belt. The doctors will likely feel obligated to schedule you for a cardiac catheterization. This is an invasive procedure where they thread a long tube through a major artery all the way up into your heart to look directly at the blood vessels. This procedure carries very real physical risks, and quite often, they get inside and find exactly what you would expect in a healthy 72-year-old heart. They find some minor plaque buildup and some slight vessel narrowing, but absolutely nothing that requires emergency surgery. You were never about to have a heart attack, yet you have just survived an invasive hospital procedure, and even worse, you have now been permanently labeled as a fragile heart patient. They might aggressively put you on a bunch of new daily medications, and the resulting psychological damage is massive. Maybe you loved playing tennis before, but now you are entirely afraid to exert yourself. The screening test that was supposed to protect you has completely stolen your physical confidence. So what is the safer and more educational alternative here? Listen closely to your own body, because it is the absolute best stress test available. If you can confidently climb stairs and do your normal activities without feeling chest pain, unusual shortness of breath, or severe dizziness, your heart is telling you it is doing quite well. If you simply want to know your future cardiovascular risk without having symptoms, ask your doctor about a coronary calcium score. It is a quick scan with no exhausting treadmill and no sharp needles that measures hardened cholesterol. It provides a clear number to guide your prevention plan without forcing you into invasive hospital procedures. If you are finding this health education valuable, please take a moment to like this video and subscribe to the channel for more honest insights. Trusting what your body tells you every single day brings us perfectly to the fourth medical test on my list. I know for a fact that this one is going to be highly controversial, but from an educational standpoint, we must discuss it. I am talking about getting routine screening colonoscopies after the age of 75. Specifically, I mean continuing to get these routine checks when all your previous results have been completely normal and you do not have any special risk factors. Before I go any further, I need to make a very clear medical statement to ensure everyone understands my perspective. I am absolutely not against colonoscopies. They are a fantastic and life-saving medical tool. I strongly recommend them for my patients starting at age 45 or 50. They actively prevent colon cancer by allowing doctors to safely remove small polyps long before they ever turn into a dangerous disease. If you are in your 50s, 60s, or early 70s and you are due for a screening, please go get it done. However, the crucial educational concept you need to grasp is that every single medical test is a delicate balance between potential benefit and potential harm. As our human bodies age, that balance dramatically shifts. The primary benefit of a routine colonoscopy is preventing a type of cancer that typically takes between 5 and 10 years to fully develop and cause real problems. But if you are 78 or 80 years old, you have to ask yourself a difficult question. Is that long-term benefit still worth the immediate physical risks? Because colonoscopies do have serious risks, and those specific risks increase significantly as you get older. First, there is the intense preparation. Drinking that awful liquid keeps you in the bathroom all night, which easily leaves an older adult severely dehydrated and physically weak. Then, there is the heavy sedation, which carries a much higher risk of causing breathing problems or prolonged mental confusion in older patients. But the biggest risk, the one that truly worries us as medical professionals, is perforation. A perforation is an accidental tear in the wall of the colon. As we age, the delicate tissue of the colon wall naturally becomes much thinner. Because of this biological change, the risk of the camera scope accidentally tearing through that thin wall roughly doubles or even triples after you reach age 75. A colon perforation is a massive surgical emergency. It often requires immediate open surgery and sometimes ends with the patient needing a permanent colostomy bag. For an active 80-year-old, surviving that kind of severe complication can literally mean the sudden end of their independent living. When you weigh the terrible risk of losing your daily independence against the benefit of preventing a slow-growing problem, the medical math simply does not work out for the average healthy senior. This is exactly why most major medical guidelines now recommend stopping routine screenings between ages 75 and 85. Of course, medicine is never one size fits all. If you have a strong family history of colon cancer, if you have a personal history of removing dangerous polyps, or if you suffer from inflammatory bowel disease, your calculation is completely different. But for the average older adult with no special risks, continuing invasive screenings is likely doing more harm than good. So, what is the educated alternative? Do you just ignore your digestive health? Absolutely not. You simply shift your strategy from invasive screening to smart surveillance. This means paying close attention to actual physical symptoms. If you suddenly notice persistent changes in your bathroom habits, see blood, experience unexplained abdominal pain, or develop unexplained weight loss, those are serious red flags. At that point, your age does not matter at all, and you absolutely need a diagnostic procedure to figure out what is wrong. Furthermore, you can use the incredible power of daily nutrition. The absolute best thing you can do for your colon health at any age is to eat abundant natural fiber. Eating more fruits, vegetables, beans, whole grains, lentils, and apples safely feeds the good bacteria in your gut. This dietary approach provides powerful natural prevention for your entire body with absolutely zero medical risk. When we look back at all 4 of these medical tests, you can clearly see the dangerous pattern emerging. Whether we are discussing whole-body scans, finding harmless shadows, brain MRIs turning normal forgetfulness into severe anxiety, routine stress tests triggering unnecessary heart procedures, or routine colonoscopies after age 75 threatening your independence, the underlying problem is exactly the same. It is the cascade effect. One single test leads to another, which leads to an invasive procedure, which ultimately leads to an unexpected complication. Somewhere along that terrifying medical journey, we completely forget to ask the most important question: is this person actually better off? After 22 years of practicing medicine, the most valuable lesson I can share with you is this: true health is absolutely not about having perfect test results on a piece of paper. Health is about function. It is about your physical ability to do the things you truly love. It is having the energy to play with your grandchildren, taking daily walks, reading books, and living life entirely free from fear and unnecessary medical interference. Your ultimate goal at 65, 70, or 80 is not merely to live longer, but to live better with lasting independence, dignity, and joy. Sometimes, The absolute best way to protect that precious independence is to bravely say no to a test that will only send you down a dark rabbit hole of anxiety. I am not telling you to avoid all medical care. Modern medicine is a wonderful tool when used appropriately. I am simply asking you to become an empowered and smart patient. When a doctor automatically recommends a routine screening, politely ask a few critical questions before agreeing. Ask why you need it right now. What happens if the test finds something small that might never hurt you? What the severe physical risks of the procedure are? And if there is a safer alternative available? You and your doctor should always be partners, but remember that you are in charge of your health, not strict hospital protocols or automated computer reminders. If this educational information gave you a new perspective on aging and wellness, please like this video, subscribe to the channel, and leave a comment below sharing your own experiences with medical testing so we can all learn together.